Hello, my name is Katie Breheny and I'm a health economist at the University of Bristol, and I held a School for Public Health Research postdoctoral launching fellowship. In this presentation, I'm going to talk about the impact of my fellowship on my career and on my research. I'll start with the collaborations I've made in my fellowship. Through the efficiency and equity theme, I had the opportunity to work with other health economists in the UK. Through the NIHR FIRST and FES schemes, I've collaborated on projects with local authorities in Bristol, London and Leicester. These have led to outputs and enabled me to get first-hand experience of the challenges of applied research in practice and incorporating health economics. Through the FES project I was involved in, we evaluated a digital screening questionnaire for young people's health and wellbeing issues. 2 qualitative papers have been published so far, looking at young people and providers' perspectives. I also published a qualitative paper for my PhD that explores the use of economic evidence in schools. My fellowship also increased people's awareness of me as a health economist specialising in public health. This enabled me to contribute to several grant applications as co-applicant, including one on obesity and one on vaccine uptake. I've also used my fellowship to extend my skills. I've been undertaking NIHR Academy Leadership Lab modules, attending courses which are external and internal to the university, and attending ResNet events which have been put on by the SPHR. My fellowship has enabled me to attend several online conferences and now some face-to-face events. Unfortunately, I'm not attending the SPHR annual scientific meeting, as I'm discussing a paper at the Health Economics Study Group meeting in Sheffield. In July, I will hopefully be travelling to Oslo to present research from the DHC project at the European Health Economics Association conference. During my fellowship, I supervised an SPHR summer intern. This and other opportunities enabled me to apply for a promotion to a senior research associate, which was confirmed last August. I'm sure my lockdown-inspired health economics baking helped this promotion too. So what's next? Although my fellowship has ended, I will remain involved with the SPHR through the alumni network and Bristol's membership in SPHR 3. I will apply for further fellowship funding and continue to progress as a health economist specialising in public health.
Hello, my name is Penny Breeze. I'm presenting on my postdoctoral launching fellowship from the SPHR. Prior to the fellowship, I was working as a health economist. I completed my master's and PhD in health economics and economic valuation. I was working on several modelling projects using microsimulation modelling methods, and also had an interest in statistical analyses of longitudinal data, particularly where these are used to inform model parameters. My areas of topic interest were around diabetes prevention, cardiovascular risk models, and I was starting to develop an interest in applying these models to evaluate population-level dietary interventions. The postdoctoral fellowship has provided me an opportunity to develop several skills throughout the last 2 years. Firstly, I think I've developed my skills in leadership and management. I took on roles of line management of other members of staff in the department. I also led on a number of projects as part of the efficient and equitable public health systems. And I sought formal training in project management to support these activities. I've put together several funding applications throughout the postdoctoral fellowship, and particularly focused on strategies for public involvement and dissemination, and how my skills could be developed to enhance these in future applications. Areas of research methods where I've developed my experience around complex systems modelling. I've participated in projects to develop guidance on complex systems models, and also sought formal training in systems dynamics modelling and agent-based modelling. The postdoctoral fellowship has enhanced my career opportunities and my career development. Most notably, I've secured research funding to evaluate several different diet-related interventions and policies. The main one being that I've led on a project to evaluate an application for funding to evaluate health, economic and labour, environmental and inequalities of the impact of food taxes. I've also been collaborating with Professor Paul Aviard and Professor Susan Jebb across 2 different funding applications to evaluate the cost effectiveness of dietary interventions to induce diabetes remission. The postdoctoral fellowship has given me an important opportunity to raise my research profile. Firstly, locally, I've developed collaborations with Sheffield City Council and third sector organisation Sustain, who both have an interest in dietary policy research. I've also raised my international profile via a research visit to the University of Sydney and been discussing research proposals with academics out there. The postdoctoral fellowship has given me an important opportunity to plan for my future research ideas and prepare future applications in addition to the ones already secured. Thank you, and if you'd like to get in touch, please feel free to email me.
Hi, my name's Rebecca Mead from Lancaster University and part of the Lilac membership. I was awarded ResNet funding to undertake a pilot study to look at the local response to the COVID-19 crisis. The ResNet funding was a great opportunity for me to explore an area of personal interest, to consolidate existing research leadership skills, and also to test out ideas for future career plans. My research interests lie in addressing the wider social determinants of health to improve health and reduce health inequality, and to do that by applying an equity lens to local policy making across a broad range of policy domains. I'm also interested in exploring intersectoral working and power dynamics as part of the decision-making processes at the local level. So I was able to apply these two interests, equity sensitivity and intersectoral working, to the local COVID-19 response. I interviewed strategic leaders coordinating the response, and what I found was that equity issues were central to their objectives. They described them as impossible to ignore as the poverty crisis quickly followed the health crisis. And responding to that, effective community engagement was considered vital, and lots of work was undertaken to really scale up engagement activities. And the COVID-19 crisis was unifying. It brought all of the strategic leaders at the local level together, and they described that as really creating strong relationships between them. And these three things combined contributed to innovation in service design in a number of ways. So in relation to the food distribution that was being rolled out across the country, in many areas new policies were developed for responding to cultural food preferences. In relation to outbreak management, in some areas they had volunteer-led door-to-door engagement activities in relation to test, trace and isolate. And in some areas, to combat vaccine hesitancy, the vaccine rollout was actually handed over to the community, designed and delivered by them, with clinicians in supporting roles rather than leading roles. So there was lots of innovation at the local level in responding to the unequal impacts of the pandemic, but local leaders described how political and financial pressures were returning, and as such the policy window for innovation was closing. So in my future study, I'd like to examine equity sensitive policy making at the local level across a broad range of policy domains, covering the wider social determinants of health, and draw on knowledge from the political sciences, including that of power dynamics and decision making. Thank you.
Hi everybody, I'm Dr. Cheryl McQuire, based at the University of Bristol, and I'm going to talk to you a little bit about my NIHR SPHR postdoctoral launching fellowship that I started in 2020. So I suppose one of the first things to note is that this fellowship offers a really rare opportunity to have protected time to develop yourself as a public health researcher with a view to becoming a future leader in the field. So for me, my area of interest is child and maternal health and prenatal alcohol use. And that's something that's continued from my PhD work into this current fellowship and hopefully into future funding applications as well. So one of the really key aspects of being part of the SPHR is the really great opportunity for collaboration across all the different member institutions. And that's something that I've drawn upon through doing a mixed method study around prenatal alcohol prevention with different colleagues across the SPHR, as well as practitioners. And these collaborations that I hope will last well beyond the length of this fellowship. Secondly, the fellowship gives you a really great opportunity to build your CV, and one way that you can do that is by accessing the great training that's on offer through the NIHR Academy. So for me, that's been things like training for developing advanced fellowship applications, as well as other research skills. And you've also got your dedicated training and development budget that you can use to access leading external courses, for example. The NIHR SPHR Launching Fellowship is really geared up to helping you develop really strong applications for future funding. So, for example, in my time, I've been developing an NIHR Advanced Fellowship application on fetal alcohol spectrum disorders and routine data. And as well as that, I've pursued opportunities to get smaller pots of funding, for example, CCORM funding and participant public engagement funding. And this has further strengthened my CV, but also given me really valuable experience as a principal investigator. So having the time within my fellowship to do that was really, really helpful. Next, the fellowship gives you time to increase your publication record, and that can be done in various ways, for example, by working within existing SPHR work streams. So I've been contributing to the natural experiment work stream within the SPHR, and also, for example, if you've got publications from your PhD that you would like to complete, it gives time for that. And finally, another great aspect of the fellowship for me has been the opportunity to complete a practice placement. So I did mine with North Somerset Council, and I helped develop their wellbeing and health strategy through developing workshops for stakeholders and doing qualitative data analysis within that. And that was a really great opportunity to see how public health can be performed in practice, and also the resulting outputs that it can have to hopefully benefit population health. So thank you for listening, and I hope you enjoy the rest of the conference.
Hi everyone, my name's Ruth Plackett and I was an NIHR School of Public Health Research postdoctoral launching fellow based at UCL, and I'm going to be talking to you about my experience as a fellow and some work I've been doing on social media and mental health. So here's an overview of all the different things I've done and achieved in my fellowship. So I undertook a remote placement with South Gloucestershire Local Authority for about 3 months. And while I was there, I got to contribute to some very interesting projects and to learn a bit more about how decisions are made in public health practice, which I found really helpful. I also undertook a lot of statistical analysis training, such as training on multiple imputation and training on longitudinal data analysis. I also was able to identify a mentor, and I found that really helped with my career development and helped me to widen my network within SPHR. I also contributed to 2 projects in SPHR. One was a ResNet project looking at the impact of school and peer connectedness on adolescent mental health during COVID, and the other was contributing to work evaluating the psychometric properties of measures of social connectedness. I also wanted to tell you about my own research ideas and my own research project that I undertook. So I explored the longitudinal relationship between young people's social media use and mental health. And one of the specific things that I was also going to look at during this was whether factors like self-esteem and social connectedness could explain that relationship between social media use and mental health and act as mediators. So for this, I used the Understanding Society Youth dataset, which is openly available, and I had about a sample of 3,000 young people who had social media use data at 12 or 13 and mental health data 2 years later. So I found some relationship between social media use and mental health, as I did find that those who spent 7 or more hours versus none tended to have slightly increased mental health problems, but this relationship did disappear after it accounted for other factors like their mental health at baseline. I also found that social media use was associated with lower self-esteem, which in turn was also associated with more mental health problems. and that 68% of the effect of social media use on mental health was explained by self-esteem, so did kind of fully mediate that relationship. But again, these relationships did disappear after accounted for other factors like their mental health at baseline and in imputed data. So ultimately, I think the study shows the importance of looking at longitudinal evidence. A lot of cross-sectional studies have suggested that there is a relationship between social media use and poor mental health, but my data might suggest that it's not that causal. And the findings also suggest that we might not expect to see huge gains from interventions that focus solely on, say, reducing social media use, and that other factors such as self-esteem should also be considered. I also wanted to share some of the outputs from my fellowship, which I think are really important to highlight and celebrate. So firstly, I did gain a lot of insight into public health practice, both through my placement, but also from working alongside public health practitioners, and I found that so helpful. I was also able to develop and build my CV by publishing my PhD papers, and I'm currently drafting first and co-author papers from the projects that I've been working on, but also from my own research project, which is fantastic. I was also really able to build my network and make some great collaborations across the network, which was really helpful for applying for things like further funding. And I was actually successful in gaining further funding off the back of this fellowship as well, which is fantastic. So now I'm doing a fellowship with the NIHR 3 Schools Mental Health Programme at UCL for the next few years. And finally, I'd just like to thank you all for listening and thank SPHR for this fantastic opportunity.
I'm Katie Powell, and my fellowship is at the University of Sheffield, where I'm building my knowledge, ideas and network in the field of place-based health inequalities. A key element of the fellowship has been a practice placement, as this was an area where I wanted to build knowledge and connections. In particular, I wanted to develop a better understanding of local government commissioning processes and health needs assessments, specifically as they relate to place. I set up a placement with a Yorkshire council to learn more about their work, and I've had the flexibility to work with them in ways that benefit their work and mine, doing evaluation of their physical activity programme, exploring commissioning processes. Having had the opportunity to develop a relationship with public health colleagues in local government, I co-developed a research bid with them. And the gap we've identified is about operationalising relational and dynamic ideas of place, and a need for approaches that integrate biomedical and community knowledge on health needs within particular localities. We've co-designed a project to develop participatory methods for integrating public health knowledge with community knowledge on local public health issues. I'm currently supporting the development of the Council's Adult Health and Wellbeing Survey and their plans for local area coordination through asset-based work. Another key element of my fellowship has been developing my academic network. I submitted a bid to the Foundation for the Sociology of Health and Illness and won funding to deliver a workshop for sociologists in public health. This was to understand how this group can improve their impact. The workshop identified approaches and methods sociologists have used to successfully influence public health. It also identified priority actions to raise the profile of the discipline in practice and to develop organisational support for sociologists working outside of academia. The fellowships also allowed me time for writing, consolidating my contributions to place-based public health. So far, I've produced a blog post to stimulate discussion on the use of sociology in public health, and I produced a methodological paper drawing on PhD data and my broader experience of evaluation of place-based interventions.
Okay, perfect. Thanks so much, Vanessa, for organizing this and for inviting me today. My name is Sarah, and I am a research fellow at the London School of Hygiene and Tropical Medicine. Before going into details of the SPHR postdoctoral fellowship, I thought to give you a little bit of an update of my research career to date, because I thought that it's always useful to see how previous applicants, the background, etc. So one thing I wanted to say is that my passion for public health and reducing health inequalities is reflected across all areas of education and experience to date. Throughout the years, I developed an interest in some particular areas, including place-based strategies to reduce health inequalities, and also methods that meaningfully engage communities, policymakers, and service providers. I specifically focus on photo voice methods, which I applied in the UK and also Sub-Saharan Africa in my research associate position. So very briefly, I obtained a BSc in public health and health visits in Italy. And then I moved to the UK to do a brief internship, which really gave me exposure to the research field. And I became very interested in a career in public health. So I undertook a master in public health in London. And then this really stimulated me to really take more a research career in this field. And I applied for a NHR SPHR PhD studentship, which was part of the Aging Well program. So it was the so-called first school of public health. And then it was undertaken within the LILAC collaboration, specifically the University of Liverpool, I was based. I got my PhD in February 2017. And then I successfully decided to apply these photo voice methods in different contexts. So my research associate position was included a work in Cameroon. And then took an opportunity to actually broaden up my teaching skills. So there was an opening up in my university. So I took 1 year maternity post, contributed to the Master in Public Health program, and which also really gave me an understanding of mentoring and supervision. Yeah. And then I took up another research associate position working on NHR global health projects. So throughout my research, I really worked in different NHR projects. And then when there was the opening for the first postdoc fellowship application, I decided to apply. And I was always been interested in joining London School of Hygiene and Tropical Medicine because of the research that they're doing and the team. So I approached the London School of Hygiene and Tropical Medicine to see if they could support me in this path. And then I'm currently doing the fellowship. I also undertook a secondment as a part of this opportunity at the Greater London Authority, but I also kept my honorary researcher associate position at the University of Liverpool. So this is me in a nutshell. I thought to briefly say that my house institution in the London School of Hygiene and Tropical Medicine, I started in April 2020, although I went to maternity leave for 7 months. Through this fellowship, I also applied for an internal grant. So this adds 3 months to my contract. So my end date of the current NHR SPHR fellowship is April 2023. Firstly, I would like to speak about how doing this SPHR fellowship really impacted on my research experience and has helped me to really form me as an individual and to undertake this path in career in public health. First of all, I thought that the SPHR fellowship really gives you an excellent chance to have mentorship. So I could access supportive mentors and experts in my field. And currently I'm mentored by Prof. Matt Egan. But I also have not only a mentor that provides me career and research support, but I also have access to a career development mentor. And also through the School of Public Health Research, we were also encouraged to find an external mentor with Prof. Jenny Poppe, and who is also playing a great role in my NHR Advanced Fellowship application. But not only formal mentors contributed to this fantastic experience, but I also could access a wider support. So for instance, Andy, the training manager, really played a key role in supporting me through the process. But I also met wonderful fellows, and also SPHR and London School of Hygiene colleagues. They really helped me to feel at home, and especially since I joined the London School of Hygiene during the pandemic, also this scheme. So thank you. In terms of what I gained from the fellowship, this scheme really enabled me to further my skills. And here I mentioned some. For instance, I was able to strengthen my research, team working, project management skills, and also my ability to work with underserved groups. It gave me an opportunity to build new collaborations, which is very important, especially for a new early career researcher. So I got the opportunity to get involved in two main research projects. One was the Places and Communities project, and one was the Health Inequalities project, Equal England. Two different projects, but they really fit within my interests and career trajectory, so places and health inequalities. Through the Places and Communities program, I was able to further my skills in systematic reviews, and as well as finding great colleagues and collaborations within Newcastle, Lancaster, and Cambridge universities. And this also led to outputs, so one paper was published. Through the Health Inequalities project, I was able to further my skills in qualitative research, specifically online methods, because as we know, we had to conduct the research online. And also I was able to find great colleagues and collaborations with Newcastle and Sheffield universities. And also this is leading to outputs, because one paper is also ready for submission, one paper is in preparation, and we had one conference presentation. So this is through projects. One of the most valuable things that I felt that SPHR fellowship gave me was protected time to publish from my PhD thesis and previous work, but also prepare applications for future funding. So in terms of papers, for instance, and for the funding, I was able to, for instance, publish my papers from my last paper for my PhD. One first paper as senior author, which will be very important for my career. I also have other papers in the pipeline, so it really gave me protected time to concentrate on this. Also led to further funding, so I was able to prepare an internal grant to do scoping work for my NHR Advanced Fellowship application. I was able to concentrate on this application for a long time. This also included being able to spend time to build a public involvement advisory group and to have the funding through the training budget to do so. And other things that contributed were not only research skills, but also leadership skills and new collaborations. For instance, I was invited to sit on strategic operational committees within the SPHR. And one particularly important was the SPHR Public Involvement and Engagement Operational Group, and also the Equality, Diversity, Inclusion. Specifically, the Public Involvement Group really gave me an opportunity to find mentorship through, for instance, Jenny Poppy. She's also a current member of my NHR Advanced Fellowship application, but also to approach people to form my steering committee members. So these were great opportunities that I would not have got without the SPHR fellowship. And other things were also that enabled me to access to a wider network, because the SPHR is member of the, being part of the SPHR means that you're a member of the NHR Academy. So I applied to become an early career researcher mentor, serving on the NHR Academy Mentoring Steering Committee. This again is a great opportunity in terms of career path. And also I could access the NHR Academy Mentoring Scheme, so an extra one. I was fortunate enough to be able to do a practice-based placement at the Greater London Authority. So the SPHR fellowship provides you with 12 weeks possibility to undertake a practice-based placement of your choice. And this is actually the office. So every time that I went to the Greater London Authority, I could see the shower, which was not a bad view. The aim was to really strengthen my public health and policy skills and to work with the housing and health team. I conducted 2 pieces of work, which were particularly important. But what I want to highlight from this is that it was a great, valuable experience. I met some wonderful colleagues, and it really gave me access to mentoring from senior colleagues. And one thing that I can take home from this experience is that I use my research skills to contribute to policy development, and really gave me a sense of how fast-paced is working in this field, in the public health practice and policy field. I was able to present the findings to the London Deputy Mayor for Housing and Residential Development. A great experience, quite intimidating at first. I only got 5 minutes, and then I also linked with the community engagement team, which again, it was really part of my career aspirations. And also, funny enough, I probably found the best espresso coffee in London while doing this experience. So I think that doing a placement is a great opportunity that schemes such as the SPHR Fellowship offer you. So it's great, has been great. Finally, I would like to say that the SPHR Fellowship provided me with a generous training budget, which enabled me to strengthen my research skills, but also being able to extend also some knowledge and exchange and communication skills. I also dedicate to passion and public involvement and also workshops a career. Thinking about probably the missed opportunities, I think that the SPHR Fellowship has been a great scheme, but of course there were some missed opportunities. They were entirely due to the COVID pandemic. So for instance, I got limited opportunity to interact face-to-face with people, but although the online world really taught us a lot. And also it was more difficult, of course, to link with current SPHR fellows, but this won't happen hopefully this time round. And some tips finally. I started early, so I will start early with every application. I contacted the SPHR member early on, so that, and I think it's an important thing, so they can really support your application. And look very well at the shortlisting criteria. I tailor the application to this criteria. And one important point is clearly demonstrate your academic trajectory, also your commitment to an academic career in public health. And demonstrate also how you can contribute to the SPHR programs. Look at the programs, look at the roles, see how you fit within this. And also really demonstrate how the SPHR research priorities fit within your interest aspiration. Lastly, I would like to say that I didn't have a very precise research idea for a future fellowship. I had some research interest I wanted to develop, and I was very passionate about this. Also, I was very clear on why this was the right time for me for the fellowship rather than a project grant. So try to explain clearly well the purpose of what you want to achieve. And these were two very important questions that I kept next to me while I was writing the application. So I thought to share this with you in case they're helpful. Thank you.
Thank you very much for inviting me to this session, Vanessa. And it's very good to see familiar faces and new ones. So my name is Nasmi Villarreal. I'm a lecturer in global public health. I did my fellowship and 2 years ago, and I just finished in January, actually, at the end of January. Today, I'm going to talk a little bit of, I think it's important before I start talking about the fellowship, that you know me a little bit, who I am and how I end up doing this wonderful fellowship. Then I'm going to talk a little bit about, the good, the bad, and the ugly related to the fellowship, and you'll see. And then some 5 tips for this successful application. So what you can see here is a picture that was taken by my colleague Christoph Badino while working during the refugee crisis in the Serbian-Croatian border. And what you can see here is an accompanied minor, a Syrian refugee, who was trying to cross this border. So during my postdoctoral research in Edinburgh, I had the opportunity to collaborate with doctors of the world. And what you can see in this image is that I'm a person that is a researcher, but also a public health activist and an applied researcher. I want to see what's happening in the world with my own eyes. So let's talk a little bit of my career path. So the academic path started working night shifts in a hospital. I know it doesn't sound very appealing, right? At the same time, I was pursuing a master's in international health. So I was wondering why I had so many cases about gender violence in the hospital, why there was so many cases of HIV in homeless women. So I started to that was when I really started questioning what was happening in the community. And that's why I wanted to pursue a master's in public health. So I finished my master's in public health, and I had the wonderful opportunity to do it in the Public Health Agency in Barcelona, where I focus on the social determinants of health, looking at the migrant population and health inequalities. And I wanted to understand what we need to achieve health equity. And that's why I continue and did my master's and my PhD in public health, and I finished this in Barcelona. I had the wonderful opportunity to go to Scotland and did a postdoc with my mentor, Professor Raj Bhopal. And after that, I went into to Ireland, and I did another postdoctoral training with Professor Anne McFarlane, looking again at health inequalities among migrant groups. Parallel to my different research experiences, I was actually collaborating with the community and with different NGOs such as Save the Children, Doctors of the World, DORAS, and MedAct. And I was looking to a place for a funding opportunity that actually really value the importance of academic curiosity and academic freedom, but also a place where I can develop further my own academic identity. So I came across the NIHR, and this was one of the best things that happened in my research life. I was able to collaborate with wonderful researchers and mentors, such as my professor, Sarah Solway. And thanks to this great opportunity, I was able to produce some outcomes during my fellowship. And actually, I'm still working with different colleagues, such as Soro Ronsi, that I had the wonderful opportunity to collaborate with in the Polyglot project, but also at the moment I'm producing a paper with colleagues from ARC South London, working on maternity health inequalities, but also I'm writing a scoping review looking at access to local authorities and the third sectors from ethnic minority groups. I had the opportunity to also write some papers in regards to the use of the access of a health service to from ethnic minority groups. So I collaborated with colleagues from Ireland, Edinburgh, and also Manchester. And one of the latest publications was a great collaboration with a review on ethnic inequalities with the Race and Health Observatory with colleagues from Manchester and led by Dharmi Kapadia. So these are one of the wonderful outcomes, but I think this was not possible without the support of Sarah Solway, without the unconditional support of Andy during the whole process, and obviously with the great support that I had during this fellowship from colleagues like Katie, Sarah, and a bunch of really great colleagues that we supported each other during the process. But let's talk a little bit about the good, the ugly, about the fellowship. I'm going to start about talking a little bit about the bad and the ugly, and this is all related, as Sarah mentioned, to COVID-19. I arrived in Sheffield a month before the COVID pandemic. So I arrived to a new city and a new institution, and then COVID happened. So obviously I was not able to, I naively thought I was going to be able to, to collaborate, to start doing some research networks, to go into conference, and that didn't happen for all of us, right? Another thing I think it's important to take into account, and this was because all the researchers and all meetings were taken online, we had a significant amount of administrative tasks developed to meetings and different working administrative tasks, right? Then obviously the imposter syndrome sometimes doesn't go away, but you need to fight towards it. The ugly was the resilience against the backdrop of stress and uncertainty. It was a time of uncertainty. For 2 years, we didn't know what will happen. Also, my family do not live in this country, they live in another country, so we do have care responsibilities. And although we know that research is a very long and lonely journey, if we add COVID-19 into the mix, that was definitely outstanding, right? But there are really, really good opportunities with this fellowship. I had scope to develop my professional personality. I did obviously had my academic freedom. I developed professional and leadership skills. I had the opportunity to collaborate between different research institutions. I collaborate with Sarah and with different colleagues, and this was a wonderful project. And we're still, we were colleagues, professional colleagues, and now we're friends. So this is wonderful. I had 2 placements opportunity actually, because I worked with the Sheffield City Council during the COVID pandemic and looking at the impact of the COVID-19 among BAME population groups. And also, as I mentioned before, I had the opportunity to collaborate with ARC South London, looking at health inequalities among women at risk of preterm birth. The training budget it's really great. So you had there a great opportunity to use it. I use my training budget to do different courses specifically focused to my research area, which was statistical analysis. So that's where the training budget, obviously I couldn't use it for traveling to conferences or, research networks, but that you have it there. So that's wonderful. And again, obviously publications is something that is a very, very good outcome. So 5 tips for a successful application. And I think, as Sarah mentioned, time is crucial. You really need to leave enough time to prepare a very clear and well-organized application. This takes a very long time, at least 6 months, if not more. So understand also the need of your funder. Give them what they want. Remember to check out the remit is really important. Understand and help your audience. Reviewers are really busy, so a clear and well-structured application is key. If you can add extra information, pathways to impact, and how will this research have an impact in your application, then that will be great. And remember to ask for help and seek, if you can, internal review from your institution. And I think one important thing that we need to bear in mind, and not to be naive, there's going to be a lot of competition, and probably there's going to be people that are better than you, but remember that you are unique. So show that in your application. Thank you very much. This is my email in case you want to contact me, and thank you.
Thank you, Nazmi. Thank you so much, especially for sharing your personal